And now, once again, let me welcome everyone to our webinar on Healthy Officers Are Safer Officers, the Nexus Between Performance and Health. Today's event is convened by the Harvard Kennedy School's Ash Center for Democratic Governance and Innovation and the National Institute of Justice. Our moderator is Brett Chapman, a social science analyst with the NIJ. Brett will be starting.
And I just want to start off by welcoming everyone to this session. Thank you all for joining us today on this session on officer safety and wellness. And I'm going to say I'm not taking any ownership over that picture right there because it makes me look a lot more grumpier than I probably am, than I think I am. My wife tells me that I am always a grump, so she might be right, but I would still disagree. But in any event, again, thank you all for joining us. Of course, NIJ is the research, development, and evaluation arm of the U.S. Department of Justice. I'd also like to take this opportunity to thank the Harvard Kennedy School's Ash Center for Democratic Governance and Innovation, the funder of this webinar. Our partnership with Harvard University is one of many efforts that we value dearly. NIJ also appreciates their support in setting up this webinar and putting it into motion. I'd also like to thank you again, all the folks who have joined us today. As I looked at the roster, I was not surprised to see the large number of law enforcement personnel from chiefs, sheriffs, and other command staff down to detectives and patrol officers from across the U.S. But I also would note that we have a number of other folks joining us today, members in the academic community, students, county government personnel, corrections staff, parole and probation staff. Some of our federal partners have also joined us today. And we also have a number of people in the mental health care providers area as well. And I'd like to give a special welcome to our friends in Canada, the UK, and Australia. Finally, and last but not least, I'd like to give a special thanks to NIJ's Office of Communications, particularly Nancy Ritter for her assistance and for their assistance in this effort and for getting us here today. So I'm very grateful for their efforts. So why are we here? Well, I think today's session represents a continuation of NIJ's investment in officer safety and wellness. And what I mean by that is these initiatives, projects, research are all focused on keeping officers safe and promoting a healthier way of life for them. You may be familiar with our Corrections and Law Enforcement Family Support Program that we launched in the late 90s, also known as the CLEFS program. We've been involved in funding a number of initiatives looking at body armor standards, less lethal weapons to keep officers safe. We have a large investment in conducted energy devices such as tasers and looking at their impact on officer injuries and suspect injuries as well. We're also involved in funding research looking at traffic safety, whether that involves vehicle markings on vehicles or trying to understand the causes of vehicular crashes, which continues to plague law enforcement. We also have funded research looking at puncture-resistant equipment for law enforcement and correctional officers. We've also funded, and I'll give a lot of credit to one of our presenters for the body of research that we have funded over the last 6 or 7 years in the area of officer stress, performance, and shift work scheduling. And again, all these efforts represent the continued commitment by the Attorney General, Eric Holder, as well as Mary Lou Leary, who is our Assistant Attorney General here at the Office of Justice Programs. Now, with us today to discuss these issues, one, we have Dr. Karen Amendola, the Chief Operating Officer at the Police Foundation and here in Washington, D.C. I can't say enough about her efforts in this shift work study. It wasn't always easy, and I always say it was a Herculean effort for her to get us here today and to bring that study to a close. It's very vital in the field. From what we have seen in the field, they are really clamoring for information on which is the better shift, whether it's 8, 10s, 12s, 9s, 13s. Some questions, some officers, departments have gone to or considered 24-hour shifts. That's a little interesting. We also have Dr. Brian Vila, and he was one of my former bosses here. I will take credit for keeping him out of trouble when he was here. He was a great guy to work for, and he was really instrumental in getting us to kind of reprogram some of our research efforts to the body of research that came out of our CLEPS program in the late 90s. He is a professor of criminal justice and criminology at Washington State University and the director of the Simulated Hazardous Operational Task Laboratory at WSU. We also have Dr. John Violante, a professor in the Department of Social and Preventive Medicine at the University of Buffalo, and Dr. Violante also was a previous member for 23 years in the New York State Police. So he brings another perspective, and so does Brian, as a former officer, to the table. And last but not least, we have Chief Theron Bowman, who is, I tell you, when I describe chiefs who have an appreciation for research, I just describe them as they get it. He's a person who has always had a tremendous appreciation for research, and that really has made the work of researchers a lot easier when a chief is willing to let someone in the door and to not look over their shoulder, not to kind of guide the research or say, what is it going to say? No, that's not the type of chief he is. He also holds a doctorate in urban and public administration and is currently the interim deputy city manager in Arlington, Texas. So I am certainly grateful to have all of these individuals here today with us. Now, that said, how we're going to proceed, I am going to start off with Dr. Amendola. She's going to lead off, and then she will be followed by Dr. Vila, and then Dr. Vila will be followed by Dr. Violante, and then we'll let the chief kind of comment, take in the presentation comments and kind of comment on all those, because of course he is someone who is grappling with all of these issues in his department in Arlington. And then I will open the floor for questions. So with that, Dr. Amendola.
Well, good afternoon, everyone. I'm really happy to be participating in this webinar, and thank you, Brett, for the kind remarks. I would like to join Dr. Chapman in thanking Harvard University's Kennedy School and the National Institute of Justice for promoting this webinar, and NIJ specifically in supporting the research that we conducted here at the Police Foundation. As you'll see on your screens, the title of my presentation is Why Shift Length Matters. And the reason I am going to talk about this and why I think the issues of officer safety and wellness as well as their health is so important. And I'd like to start by saying that this isn't only about officer safety, but when you talk about officer safety, wellness, and health and prevention of accidents, I believe that importantly it extends to the communities in which we all work and live, and if the officers themselves aren't safe, then the communities may not in fact be safe. So I think it's an extremely important issue. Most of us are used to being cautioned by flight attendants that we ought to secure our masks first before helping others. And I think that this body of research and this area of inquiry really speaks to that same point, that if we can't make our officers safe and healthy, how do we expect to have them provide a safe environment for the communities? I'm going to start by talking about some work that we did here at the Police Foundation, and the way that this came about was that I had been visiting police departments all around the country, and I was hearing more and more frequently and reading about more and more frequently that police agencies had started to abandon 8-hour shifts and to move to alternative kinds of schedules, 10-hour shifts, 12-hour shifts, as Brett mentioned earlier, even 24-hour shifts. And so I wanted to get a handle on why that was occurring, and it was really curious to me because I couldn't get a good explanation. At about the same time, the National Institute of Justice put out a solicitation for research to examine shift length or other aspects of shifts that affect performance, health, safety, and other factors. And so the study that I have conducted with my colleagues, including Professor David Weisberg, who won the Stockholm Prize in Criminology in 2010 for his work on crime and place, and many other of my colleagues, we worked on a study that would examine the impact of different shift lengths. But before we did that, we started out at the very beginning by trying to get a descriptive picture of really what the agencies were doing and why they were doing it. And so we randomly selected 300 agencies with 50 or more sworn officers, and we received a 96% response rate. Then in 2009, 4 years later, we did the same survey with the same 300 agencies and got 100% participation. And what we found is that primarily that it was true that agencies were moving away from traditional 8-hour schedules and trying shifts out that ranged anywhere from 9 hours to 13 hours and anywhere in between there in some odd configurations. But importantly, we also found that most agencies have now abandoned, especially now by 2009, they had abandoned rotating shifts by and large. They're still about 25% or more doing rotating shifts. And when I say rotating shifts, I mean rapid rotation. When you hear from Dr. Violante, he may touch on this briefly, but rapid rotation of shifts, particularly from a day to an evening to a midnight in a short period of time, can actually cause significant health problems along with pose immediate kinds of risks. So it was good to hear that they had abandoned those. And so the key finding there was that by and large, the smaller agencies were still favoring 8-hour shifts, but also had begun to look at 12-hour shifts as well. And so we had pretty equal numbers of 8 and 12-hour shifts amongst the smaller agencies. But among the larger agencies, in 2005 and again in 2009, they tended to favor 10-hour shifts. Not to a great degree, but certainly about 35% of them. And so that was followed by 8-hour shifts, and in some cases 12-hour shifts being handled by those departments. So what we did before we knew about the trends that we got to in 2009 is that we decided we would conduct a randomized experiment, and NIJ provided the resources for this. It's never easy to do research in police departments, but we were able to get the agreement of both Detroit, Michigan, which is a large Midwestern police department, and Arlington, Texas. And Chief Bowman will be on the call momentarily at the end of this discussion to talk about Arlington, Texas. But he took this on because being a PhD himself, I think he realized that in order to do best practices, you had to really base those on science. And so we conducted this randomized experiment in both agencies, and you'll be seeing now on your screen some pictures of some of the things that we did. But we basically took about 325 officers and assigned them to either 8, 10, or 12-hour shifts. And by and large, we got a very high participation rate. We ended up with about 84% of the officers. And so we did a number of things. I'm just showing you here a few of the simulations that we conducted: a driving simulator, a shooting simulator, active shooter situations, a pupillometer that's a direct eye measure of fatigue, and some other kinds of things like video vignettes that would get at their interpersonal skills. And what we learned from this is that there were some significant advantages of 10-hour shifts over 8-hour shifts. Specifically, and probably most important and having the most implications for policing, is that they got a half-hour more sleep per 24-hour period. I say per night, but it's really per 24-hour period than those working 8-hour shifts. So roughly 3.5 hours a week, which is significant when you look at that over the course of a year. Even within a week, it's quite significant, and it can lead to much reduced fatigue. We think that although this finding is somewhat inconsistent with other studies, including that conducted by Brian Vila, who's on the call as well, that it's probably because we were tapping into not only the primary sleep period, but also asking about nap periods, like secondary sleep during a 24-hour period. So that was significant. Also, officers tend to like the 10-hour shifts better, and to the extent that an agency wants to try to offer some benefits in that regard, it was a big advantage. But even more importantly, from an administrative standpoint or a city manager standpoint, the officers on the 10-hour shifts worked significantly less overtime. In fact, those on 8-hour shifts worked 5 times more overtime than those on 10s, which for many of you who are law enforcement administrators know that with the shrinking budgets, this is a major thing to cut back on the costs associated with overtime. Part of that is associated with the fact that if you run 3 10-hour shifts in a day, you're getting 6 hours more of coverage, and you can schedule it in ways that allows you to maximize the coverage of police on the street at times when your peaks are, provided that you can work that out. Additionally, the 12-hour shifts didn't have these advantages, but it had some negative findings associated with it, that those on 12-hour shifts were sleepier and less alert while at work. Now, we did not find any significant differences in performance as a result of being on an 8, a 10, or a 12-hour shift, and so I think that that's an interesting finding for chiefs that do want to continue with a 12-hour shift or are considering 12-hour shifts. However, I would caution, based on the findings of this research and other research that's been conducted over the years, that agencies do that with caution and seriously consider how they're monitoring off-duty and overtime employment, because once you get beyond 12 hours, you start to get in areas where the past evidence has suggested a lot of risk for greater accidents and injuries and other kinds of problems. So to conclude, I think that the agencies working on 10 or 12-hour shifts shouldn't be too concerned about performance problems, but those wishing to adopt 12-hour shifts should proceed with caution because of the safety hazards that could apply, especially when people are working in excess of 48 hours in a week. And that the cost savings related to overtime are likely going to be experienced by both those agencies using 10-hour shifts and those using 12-hour shifts. In essence, the 12-hour shifts also provided some benefit in terms of reduced overtime. However, I'm not certain that the risks outweigh the benefits. Certainly, the takeaway from this is that 10-hour shifts do seem to be advantageous. And certainly adopted greatly by larger departments at this point, and probably for a good reason. So I wanted to finally alert you to the fact that a practitioner report is available. You should be seeing it on your screen as the shift length experiment. It's available at the Police Foundation's website. And you can also look at, on the right, the Police Foundation report that summarizes the survey of 300 national agencies about the practices that they were employing, and it would give you more detail on that as well. So that's looking at 2005 to 2009. With that being said, I believe my time is up, and I'd like to turn it back to our moderator, Dr. Chapman.
Okay, thanks, Karen. One question, I have a question here about the hours of sleep that officers got. You said that officers got a little more sleep per night on 10s over the 8s. What was that average number of hours that they got in terms of sleep?
Oh, actually, yeah, it was about 7.5 hours on average. And that, as I mentioned, Dr. Vila's research is somewhat inconsistent with other studies that have shown that officers on average get less than most people, around 6 or 6.5 hours. Brian can certainly correct me when he is up. But I do think that part of that could be just that our officers in Arlington and Detroit are tired enough, and when they're working 10-hour shifts that they do it that way. But because it's a randomized experiment, I think that we're just learning that when you're on 10-hour shifts, you're able to work in a little bit more sleep. So that is a kind of unique finding that they're getting more. And the mean, of course, across the groups was 7.5 hours. So for those on the 10s, it was slightly higher than that. And for those on the 12s and 8s, it was slightly below that.
Okay, great. Thank you. Okay, Brian, you want to take it away?
Yes, thanks, Brett, very much. All right, in the next 10 minutes, what I'm going to do is explain why we must do a better job of managing police fatigue and why we can do much better. We've got 30 years of research now that's made it plain that we need to change how we deal with police fatigue. The good news is, even though we don't have all the answers yet, we do know enough now to make much better decisions about this. And we can do it right now. Well, can we? Does change make political and practical sense in the face of the kinds of budget and staffing cuts departments across the nation are facing? In the face of widespread community dissatisfaction with the police, and because of the sensitive relations between labor and management in many agencies, especially in these tough times. And I'm going to argue that in fact, those real-world problems are the reasons that we can and we will make things better, not just because it's the right thing to do, but also because we can't afford not to. Look, the Attorney General says that the three big problems facing American policing are the economy, procedural justice, and officer wellness and safety. He's right. These are complex and difficult problems, but every one of them is aggravated by fatigue that comes from shift work, from not getting enough sleep, and from long and erratic work hours. Budget cuts have left lots of departments understaffed, and that leads to overwork, which increases job stress. I'm going to tab through this slide right quick just to get it all on the table as I talk, because we're tight on time. Well, I will if I can get the thing to work. Here we go. There we go. Sorry. So what I want you to think about here, and we can come back to this later, is that overtime and overwork and stress degrade officers' resilience and their health and their wellness, and that diminishes their capacity to do the job right. The services a department can provide aren't limited by they are limited by what just officers can do. They're not limited just by how many officers you have. So if you're going the wrong direction on this, over time you can grind down a department of the same number of officers to the point that it can't provide the services it needs to. And what this means is that fatigue management is a win-win for us. It can save lives, it can cut costs, and it can improve the quality of our interactions with the public. So here's why. And Karen's touched on a number of these topics, so you'll see us playing off each other here. Let's look at the evidence from solid research about how tired cops are, why they're tired, how fatigue degrades their performance and their safety and their health, and how much harm it does. Research repeatedly shows that nearly all cops see fatigue as a routine fact of their lives. 1 in 7 say they're usually drowsy or tired at the beginning of their work shifts. 85% report driving while drowsy. 39% report falling asleep at the wheel. Why so tired? Cops sleep substantially less than the general public, and more than 40% of them have sleep disorders. Another major source of fatigue is shift work. It's just plain unnatural. We've got to do it, but our bodies are built to sleep at night and stay awake during the day. Other problems are long and erratic work hours, overtime, and the timing and the length of work schedules. All those things take a toll. But it's not just the job that causes fatigue. Personal choices affect physical fitness as well as fitness for duty. Overall health is critical, but so are things like choosing to work a second job. Now, the consequences of fatigue are alarming. Fatigue degrades an officer's health, safety, and performance, but it does that largely by impairing the parts of the brain that we use to think clearly, to solve problems, and to anticipate the consequences of our actions. Ever asked your kid what were you thinking, and get a blank stare? That's what happens when you're too tired. It interferes with our ability to make difficult moral choices, to use technology, to interact with people, to deal with stress and frustration. And it also interferes with our ability to control our emotions like anger and fear. So do any of these things sound critical for doing good police work, for staying safe, for winning the cooperation and help of people in your community? All right, so that brings us to the next issue. What harm does fatigue do? I'll go first to a slide and we'll run through it real quickly. This is based on a smaller version of a study that we're doing in my lab right now with 80 officers. This was done with 30 officers, all from night shift. We've got 80 officers now coming in 4 different occasions, the day they're most rested and the last day of a long work shift. So the blue bar is after 3 days off, all the officers from the same department, all the same officers coming back in both conditions. The red bars are the officers after the 5th day of a 10-hour and 40-minute work shift. And what you see are statistically significant and major differences in performance, in vigilance, and in driving simulator lane deviation. We have high fidelity driving simulators we use in police academies around the country. You can see a real strong effect from fatigue. Fine. Let's look at another example here. I think most of you know about this already. When you look at fatigue versus alcohol impairment, it's obvious that both fatigue and alcohol affect your alertness, your cognition, your hand-eye coordination, your task speed and accurately. 24 hours awake is the same as a 10% BAC. And if you look at what a 10% BAC costs you in terms of probability of causing a crash, it's about a 10-fold increase. 10 times as great. Okay? What we need to know now is the magnitude of fatigue's impact on officers' abilities to make decisions in high-risk situations, to operate emergency equipment, and to deal with people professionally. I've got 3 projects going that'll get at those effects, but the results are about 2 years out. But in the meantime, and this is my main point, there are concrete things that every department and every law enforcement officer can do to start managing fatigue better. Here are some examples. Screen police officers for sleep disorders. Train officers and supervisors and managers to think about fatigue as a safety issue and to understand the basic dynamics of fatigue and fatigue countermeasures. Encourage cops to cover one another's backs for signs of fatigue because people are lousy judges of their own fatigue impairment. The parts of the brain that make that assessment are most affected by fatigue itself. Encourage people, and this is important, to do what they can. Partial measures are better than nothing. Teach every employee how to reduce the impact of shift work and why it's important, and then help them to do things like this. Leave time for 8 hours of sleep between shifts. Limit normal time on duty to no more than 12 hours. Take at least 2 days off after a series of night shifts. Find opportunities for safe naps, and at night, reduce monotony, increase light levels, monitor fatigue. And then finally, and this is really important from a practical standpoint, both management and labor have to work together to manage fatigue. Both the officer and the agency have to do their part. And fatigue gives them a common ground. A labor organization that doesn't try to make the job safer and healthier fails. So does a manager who doesn't control risks or conserve human capital. All right, so just to close this, we've got strong evidence about how to manage fatigue far better than we do right now. The kinds of practices I outlined can reduce officer deaths and improve wellness and performance. They're based on hard science. They're practically and politically feasible. Experience in the transportation industry, the military, medicine, even professional sports has shown that changes like this can save money. They're economical. If we manage fatigue better, it's going to create a win-win-win situation for officers, for their agencies, and for the communities they serve. The result that we'd expect from everything we know from 100 years of studying fatigue in human beings is safer, healthier officers, more cost-effective agencies, and safer communities, communities that are more satisfied with their police. Thank you. Thanks, Brett.
Thanks, Brian. And let me throw a quick question out to you in the group. Where does regular exercise fit into a program in terms of trying to get officers to get more rest? I mean, we talk about nutrition and we talk about getting sleep, but you don't hear as much about the incorporation of regular exercise into that regimen. So are you aware of any information out there right now in terms of how exercise fits into this?
Sure, absolutely. You need the regular exercise both to get a good night's sleep. It helps with that, especially when you're working shifts. It also helps keep you safe out in the field, which, and the accidents and injuries and illnesses and fatigue all feed back into one another. The trick is you can't go out and work out just before you're going to try and go to sleep. It takes a couple hours to cool down and your body to relax. And the other thing is a lot of people who are extra fit are getting up an hour and a half or 2 hours or more early to work out. And if they're cutting into their sleep, they're shooting themselves in the foot. Olympic athletes are paying attention to this seriously. So are special ops folks that I work with in the military world. So are the professional athletes and the Olympic athletes. So this is something that there's a lot known about.
Okay, great. Thanks, Brian. John,
you're
welcome.
welcome.
You want to go ahead?
Yes, thanks, Brian. Thanks, Brett. Hello, everyone. It's really great to talk to all of you out there. There's quite a variety of people looking at the list here, and it's a very impressive list as well. I want to talk to you a little bit about the health of police officers. Some of the information I have is just certainly not very pleasant, but I think we need to understand it, to talk about it, to get some way to resolve some of these issues. I'm going to start out with my very first slide, and we have short time to talk, and any questions you have certainly will all answer for you. First of all, looking at some of the disparities among police officers in terms of health. I often think that health disparity is more prevalent among ethnic groups and poor people, but it can also be prevalent in occupations. Police occupation is one of those occupations where this happens. For example, we looked at the difference between depression symptoms in police officers as opposed to the general population, and we found that it was almost double. So police officers experience almost a double rate of depressive symptoms as opposed to the general population. We looked at post-traumatic stress disorder, and if you look at the research, the span of research out there, you'll find that it ranges anywhere from 7 to 19% PTSD among officers. In our study, we found that about 10% of our officers had very high rates of PTSD symptoms, and 35% had partial PTSD symptomatology. So this is a problem among police, and we don't know who these officers are. I mean, they're buried within the ranks, and to me, that's a very frightening situation. The second thing we addressed is the cardiovascular disease among police officers, heart disease. One of the big areas of study in that is something called the metabolic syndrome, and I'll very, very briefly go over this for you. There are 5 components to the syndrome. Number 1 is abdominal obesity. Number 2 is hypertension or high blood pressure. Number 3 is a reduced level of good cholesterol, the HDL cholesterol in your blood. Number 4 is an elevated rate of triglycerides. Triglycerides are a lipid as well that we find in the blood, and it's kind of akin to cortisol, or to cholesterol, sorry. And lastly is glucose intolerance, which is having a high level of blood sugar, which can eventually lead to diabetes. Well, those are the 5 components. So how did the police figure in here? Well, 25% of the police officers in our studies had the metabolic syndrome as opposed to only around 18% of the United States population. So again, we're seeing a disparity in the possible event of cardiovascular attack among police officers. And again, a very frightening situation. let's move over to shift work and to get along with, to get in sync with our other presenters here. Shift work sleep and the metabolic syndrome, the thing I just described here. Officers who work nights, who work midnights, and had less than 6 hours sleep had a fourfold greater number of metabolic syndrome components than officers who work day shift. Now, if you look at that graph on this next slide here, if you would move to that next slide, please. Look at that those middle sets of bars there. Those are officers who work nights, or those are officers who have less than 6 hours sleep. The red bar indicates the midnight shift, and you can see the discrepancy between the number of metabolic syndrome components in the midnight shift workers as opposed to the afternoon and day shift workers. It's very high. What does this mean? This means that working nights may put you at increased risk for cardiovascular disease. Additionally, we found that police officers are 4 times more likely to sleep less than 6 hours than the population, and that's 33% versus 8% in the general population. Now, if you look at some of the other research, you'll see that if you sleep less than 6 hours and actually less than 5 hours, that you really can't function very well. And some of the Walter Reed studies have demonstrated that people out in combat who sleep less than 5 hours are not very effective. I know many officers from my own experience as a police officer who worked second and third jobs, went to court, worked night shifts, and put to sleep where they could. It's not a very healthy situation. Stress is another factor we have, and high stress can lead to poor sleep quality in both men and women officers, according to what we've found. Okay, next slide, please. We looked at some of the biological basis of stress and how those things are affected in night shifts as well. And we looked at a particular hormone in the body called cortisol. Now, cortisol is called the stress hormone because when you're under stress, cortisol is excreted and goes out to your body to get your body ready to deal with the stress. Those patterns you see, those 3 patterns you see on that graph, indicate what the patterns of cortisol were for all of the 3 different shifts. Now you notice the red one on the bottom. That is midnight shifts. And the ones on top are afternoons and day shifts. Night shift workers had a significantly diminished response pattern of cortisol than did day or afternoon shift workers. What does that mean? That means that their cortisol is dysregulated by circadian disruption. As Brian said, staying up all night and trying to sleep in the daytime is not conducive to your normal body cycles. It just doesn't work that way. It affects these hormones in your body, and when this disruption, this dysregulation occurs, it opens the body up for further disease. So we see people on nights who are getting more heart attacks. We're seeing people on midnights who have more rates of cancer, as found in some of the major studies like the National Nurses Study, for example. So these things are affected. Next slide, please. Another thing we looked at is the incidence of injury on midnight shifts. And the incidence of first injury on nights was 2-fold higher in midnight shift workers compared to day shift workers. 11.2 versus 5.2 per 100,000 person hours. And again, look at the graph, and you'll see on the far right, the red bar, 11.2 per 100,000 person hours. Now, another thing that happened on night shift is that those who were injured on a night shift were off a longer period of time. What that indicated was that they probably had more serious injuries on a night shift. It goes back to what Brian was talking about. You know, we can't think straight. We can't judge straight. We can't look at things in the right way when we're tired. It just doesn't work that way. Secondly, we found that the worst rate of injury was the first night back, coming off of a pass or coming off of a day off. Now, think about that for a moment. Why do you think that's true? Well, it was evident to me, again, from my own experience, that the officers burned both ends of the candle. Took care of family things, took care of things around the house, took care of their second job, took care of everything else, and then decided, well, hey, it's time to go to work, so let's go. Absolutely tired, and that's what happened. Next slide, please. Our last slide deals with a rather tragic thing, and it hurts me to look at these statistics because it's such a tragic waste of human life, and it's such a tragic waste of fine people who enforce the law out there, and it just breaks my heart. And I decided a long time ago I was going to try to find out why this is happening. Officers are killed on the street by people, but why are they killing themselves? I mean, it's just it amazes me, and we're trying to disentangle this. If you look at Centers for Disease Control data over a period of 15 years, you'll see a kind of a jagged graph there. But the important thing on that graph is that red line in the middle. That red line is called the trend line, and what that means is that if you notice that trend line is going up, that means that police suicides are increasing over that 15-year period. CDC is in the process of updating this to 2007, so we'll have better data soon. Our most recent study showed that the rate of suicide in police officers is about 18 per 100,000. In 2008, our web surveillance found 141, in 2009, 143, in 2010, 147, and so far this year, we've had 96 police suicides that we've located as of September 1st. Mostly white males, mostly in the 35 to 44 age group, mostly at the patrol level, and most of them use their own firearm. This is evident that this has to be addressed, and I personally believe that the only way we're going to address it is to find out the true rate. We really don't know what the true rate is. We can only guess at this point, and it's a lot of controversy about that. So thank you very much. Brett?
Thank you, John. Let me just ask you, one question I have from a gentleman. He asked if exercise, is it true that exercise produces chemicals that metabolize cortisol? Do you know anything about that?
That's true. Actually, exercise increases your cortisol levels. One of the, I guess it was Argonne Laboratories, found that one of the good strategies is to exercise just prior to when you go to work. This is going to increase your cortisol levels. It's going to keep you more activated for a longer period of time. So that's probably a good strategy.
Okay, and let me ask you, what do you attribute to this high number of white male officers committing suicide?
Well, as you know, the police forces in this country are primarily white male officers, and if you look at the rate of white males in the general population, it's higher than the white male police suicide rate. It's around 25 per 100,000 as opposed to 18 per 100,000 among officers. But the difference is that the general population tally includes the institutionalized, the unemployed, and the mentally ill. We don't have those kind of people in police work. We have psychologically healthy, fit people when they come into this job. But the point of that is what happens after they come into this job. What happens in those years as exposure to stress and strain and everything else that officers have to do? What happens to them? And one of the things is a psychological deterioration.
Okay, thank you. Well, before we go to the Q&A, I'd like to get the Chief's thoughts on some of what he's heard. Chief, you want to weigh in here?
Yes, sure. Thanks, Dr. Chapman. I tell you, we in this profession base a lot of what we do on evidence. And I have to commend the panelists. I think they've laid out a very strong and convincing case that we need to take what they have to say very seriously. Now, as a chief and as an interim city administrator as well, I and others like me have to recognize that these cutbacks and fiscal austerity measures we've seen over the last five years or so have really forced us to reduce costs, yet at the same time maintain productivity. Now, with these austerity measures, as Dr. Vila discussed, officers are now having to work larger beats, longer hours, more overtime, and heavier workloads. And when we start to look at the local level at where we can cut, we tend to see that health and wellness incentives and benefits education and training programs have been amongst the earliest budget casualties. Now, with these reductions in force, we also see fewer backup officers, irregular meals and irregular breaks, and ultimately more stress, as the panelists indicate. Now, this stress and these other changes start a downward physical and mental health cycle in our officers that could include depression, obesity, heart disease, diabetes, fatigue, sleep disorders, and even more. But what chiefs like me and sheriffs and agency executives and the lieutenants and captains out there and the researchers are starting to see is increased sick leave usage. We see increased injuries. We see increases in misconduct. We see increases in litigation and more substance abuse, officers going out on disability leave, and even, as Dr. Violante just indicated, increased suicides. So these austerity measures, while taken to reduce expenses, I think will likely have the opposite long-term effect. Dr. Mendola posited a little bit earlier that police practices should indeed be based on scientific evidence and what works best, and that's where I am. I think for too long in the profession we didn't know, but the cases that these folks have laid out today gives us overwhelming evidence that it's time for police executives, professionals, and these administrators to take some action. Now, my agency participated with the Police Foundation in the shift work study. We were able to take the results and determine the optimal shift configuration for our department, fully understanding the implications of all of the options. And in our agency, as well as all of the rest of the policing, we can't underestimate the value of empirical research to all of policing. That particular study helped inform my agency, but even better, the field about shift work deployment options with significant health and safety implications. I think the time is now, Dr. Chapman, that us practitioners need to heed the guidance from these empirical findings and researchers like the Drs. Amendola, Dr. Baila, and the Dr. Violantes of the world and make some changes in our business. Back to you, Dr. Chapman.
Okay, thank you, Chief. Let me throw a question out that came in. A few people have asked, and it's related to injuries across different shifts. Karen and Brian, I think you both, and John, you may have mentioned this also, were you able to, in some of your work, were you able to control for other contributory factors that may have explained the different rates of injuries across the shifts?
This is Karen answering. We did capture injuries. We did not see significant differences between the 8, 10, and 12 on injuries in our study.
In our study, which covered about 15 years of day-to-day shift data, we found that officers who had a higher workload had more injuries, especially on a night shift.
Yeah, and this is Brian. Among shift working populations in general, data from the last 40 years or so, there's a consistent thing where people who are working a graveyard shift, the time of day when they have to try and that leaves them a chance to sleep only during the daytime when the body doesn't want to sleep. Those folks routinely have more accidents, more injuries, more of just about every problematic thing you can think of. So it's a consistent piece, and we do see it in policing.
Okay, thank you. John, you mentioned suicide. Do you know, and we spoke about this on a panel that you and I were involved in with Chief and Karen as well here in Washington, D.C., do you know of some programs that have been proven to be effective in combating this problem of officer suicide? I know that discuss peer-to-peer groups. There's two parts of that peer-to-peer. There's having officers who can relate to what other officers are going through, but there's also the certification piece, having officers certified to understand some of those precursors that lead to suicide. Are you aware of any of those types of programs?
Sure, certainly. I think many departments out there have peer support programs, and they basically, it involves a selection of officers that are truly able to do this kind of job. You know, not everyone can really be a support person. And they're trained by experts, by mental health professionals, how to do basic counseling, to take care of small problems before they come big. And they're also trained to network with mental health professionals who know police officers to get them help. A second, I think, a very effective program that's out there that I think police departments should adopt is that of the United States Air Force. You know, they take a community approach to suicide prevention. They have different levels. The first level is to teach the individual about suicide. The second level is to teach supervisors about suicide, a very, very crucial area right there. The third area is to get together some community gatekeepers like chaplains and people in the community that can help and family support for officers. And the last level is medical professionals that they can network to, who know officers, who can work well with officers and help them deal with depression and psychological symptoms.
Now, the one issue that I see, and I agree with everything you just said, is the culture. Now, how do you create a culture or recreate a culture of wellness? Because officers reaching out for help, that kind of runs counter to what they learn in the academy. So how do you and where do you create this culture of wellness so that officers know or feel that they can go and reach out for help when their training is kind of not along those lines? You control the situation. You don't let the situation control you.
Oh, for sure. You know, when you have young officers in the police academy, it's exactly how they're trained. That's, to me, that's the route, to get to officers in the academy and to make them understand that they're human beings. However hard that may be to swallow, they are human beings and they are vulnerable to psychological stress. The first time they go out there and see something that's going to affect them psychologically, they're going to be surprised, but it's going to happen. The culture needs to get rid of stigma. Suicide is associated with stigma. We need to say that, yes, it happened. We need to deal with it. We need to make officers understand that suicide happened, and there's, you know, it's just another way of dying, and it doesn't indicate that this person was bad. I often quote in my presentations that it's not how you died, it's how you lived. You know, it's the dash between your date of birth and your date of death that's important. What happened in between, not the way you died. So the culture, you're right, Brett. You know, the culture is I think, the key to helping officers deal with suicide.
Okay, now staying kind of with that topic, and Brian, you also touched on this when you talked about military service. Do you know what's being done to reconnect officers who are on these deployments and are returning home? I know the IACP is involved heavily in this under some of their programs there. Do you know of any other programs where that are attempting to reconnect these individuals that go from, you know, these hostile environments overseas to coming back, and they're returning to driving on the correct side of the road? They're not looking up in buildings for active shooters. So what would you say to that?
My experience, both John and I've got military backgrounds as well as a policing background, and so I'd be curious about John. But as I talk to police departments around the country almost nonstop, one of the things that comes out is this problem of deployments depleting the departments, but they're also hiring more and more of the veterans who are returning. John and I were in a cohort of the same thing happening back in the late 60s and early 70s in policing. And I think the transition can be made. They're the same sorts of screening for PTSD would be important, and excuse me just a second. And because I work a lot with the military right now on our other research topics, one of the things that I think also bears mentioning is nearly all of the folks that I know who've been on multiple tours come back with sleep disorders, especially the frontline grunts and special ops folks that I work with. So, that'd be one of the things I'd check for is sleep disorders and get them some help if you're going to hire them. And hire them is a good idea.
Mm-hmm. John?
I agree with Brian on that. I think coming back off of deployment for a police officer, it's a whole different ballgame over there in Iraq. The kind of policing that they're doing in Iraq is certainly a lot different on the streets of Baghdad than it is on the streets of Buffalo or New York City or Detroit. It's a readjustment, and I understand that the military services do have reconstitution programs which last several months. One of the research projects I did look at found out that the PTSD and the sleep disorders, which are probably very closely connected, don't happen till around 6 months after the person's come back. So a lot of times these people are missed. I think it's very important to follow up on reconstitution maybe over a period of years to try to avoid this. And, as far as driving and shooting, another different ballgame. You're driving a Humvee in Baghdad, bumping cars off the road. It's not the same thing as driving down the streets of Detroit or Buffalo. You just can't do that stuff here. So it takes a little bit of adjustment.
Yep, I would agree. Now, staying on this, the issue of officer suicide for a minute, you said that we don't really know what that number looks like. How do you think we can increase or better account for those numbers? I mean, this is a real touchy subject, and it's one that really doesn't get a lot of attention in some instances, and not that it's not important, it's very important. But where do you see the future of departments in terms of tracking these numbers so that we can get a better feel for what those numbers actually look like?
Well, sure, Brad. Nobody wants to talk about it. It's just a topic that's kind of taboo. We don't want to talk about it. But I think the way to go is the way that the law enforcement officers killed and assaulted records are kept by the FBI. All you need to do is add another question into that system. How many suicides did you have this year? And maybe some details on what those suicides entailed. We need to collect evidence on what caused the suicide as well as how many there are. I've heard some really weird numbers out there, 300, 400, 500 a year. And these are just conjecture. There's no scientific evidence to back these things up. So we need something like LEOCA, I think, to help us understand what the true nature of this problem is.
If I could jump in, could I jump in for a second, Fred?
Absolutely.
There's some research by Professor Klinger at University of Missouri at St. Louis where he interviewed officers that had been involved in shootings. And in terms of depressive symptoms that could lead to more serious problems, he found that, contrary to some other studies, that the greatest form of support to help people get over the hump of experiencing traumas and things like that is peer support, actually other officers, not as much counselors or family members, because family members can't quite understand the stresses, and counselors because a lot of officers aren't willing to go to them or aren't willing to open up to them.
And that's David Klinger, correct?
Yes, David Klinger, right.
Mm-hmm. Yep. Okay, thanks. Well, turning away from, or to other subjects right now, one thing, this question makes me recall a study we funded under the CLUTS program where we were soliciting proposals from departments seeking to institute wellness and stress-reducing programs. And one of the questions is regarding any research that suggests working out while on duty. Now, that's going to be kind of a touchy subject, and I'd definitely like to hear the chief's input there. Programs allowing officers to work out on duty, whether that leads to a reduction in injuries.
Yeah,
Brian?
This is Chief.
And Chief, go ahead.
Yeah, this is Chief Bowman. Let me respond right quick to that. As I look
Speak up just a little bit, Chief.
Yeah, as I look around the state of Texas and at other agencies, there's a mixed bag out there. It's really difficult in these economic times for many agencies to justify the additional cost of allowing officers to work out on duty and the perceived reduction in productivity. I think that's why it's so important to have these kinds of discussions that we're having right now, so that we can see an empirical cost-benefit basis for making these decisions and help agencies and municipalities better understand every variable in this equation. Right now it's a mixed bag, but I think that looking to the future, we'll see more agencies make the commitment erring on the side of officer safety.
Okay, thank you, Chief. And kind of staying with the mixed bag that you mentioned, I'll throw this out for everyone. I wonder if you could speak about the resources or existing resources that you see or don't see for officers coping with stress when you look at urban police departments versus rural police departments. And I think I know that answer, but I'd like to hear from the group.
I think, again, Chief Bowman, the larger agencies anyway tend to have more resources that they can deploy or devote towards providing assistance to officers. We see more psychological services. We see more peer support services. We see a greater level of recognition that we're not in a period of time now where it's not cool to need some type of assistance. And larger agencies and medium-sized agencies tend to be able to better provide those services. I'm not seeing that same level of service provided to employees in smaller agencies. Some of the other researchers may have a different perspective here.
Yeah, Brett, this is Brian.
Yes, go ahead, Brian.
I think the Chief's nailed it right on the head. Every police audience I talk with, the thing that stands out is that the small agencies, the agencies with 3 or 5 or fewer officers in particular, work a lot longer hours. They don't have the kinds of health care options generally that larger urban areas tend to have. And they're hanging out there on their own. If they've got a major highway running through their jurisdiction, however rural and low population it may be, they've got a city that runs through their beat.
Well, let me ask you, are you aware of any programs where because smaller agencies represent a considerable percentage of the police departments in this country, where would they go? Or are you aware of any services for those 2-person, 3-person, 5-person departments that are in need of those resources?
I don't know of any at all, Brett.
Karen, in your considerable history of dealing with big, large, and small departments, are you aware of any?
Well, I mean, there's private resources, but in small communities, you are not anonymous.
Sure.
And I don't think it's feasible to think that you can stay in your own community and you're going to get the kind of services that are not going to be revealed in a way, except through a private therapist. Even then, people would be skeptical about going, I think.
Mm-hmm.
Brett, I'd like to add that we recently did a study on 250 departments. The smaller departments had the highest suicide rate, which was quite a surprise to us. We thought maybe the larger departments would have a high one, but it indicates that the services for these kind of services for small departments are not around. They have to go, they might have to travel 40, 50 miles to get to a therapist, for one thing. And I think that's an issue that really needs to be addressed, I think.
Yeah, possibly the national suicide hotlines, but I think once it gets to that point and somebody makes up their mind, especially a cop whose mentality is, I got to be tough, I got to be macho, I can't, do these things, they often resort to suicide because they don't want to appear as weak. And so perhaps some kind of focus in the future on a national suicide hotline specifically for police, or a national peer support line specifically for police, would probably be more helpful, because they see peers as people that they're more comfortable talking to.
Okay. And Karen, let me ask you, are you aware of, well, one thing we need to understand better is what actually happens while officers are on patrol. When you talk about incorporating wellness programs, they cost money. Typically, people will say, well, we don't have money. Then that may be followed with, well, what's the need for wellness programs for officers? Is there a need? Do you see any research out there where researchers have looked at patrol services and the need for these wellness programs?
Well, I think the advent of wellness programs, and John is more of an expert, and Brian probably too, on this, the advent of them is fairly new, and so other than the sort of traditional things like physical training and whatnot, so I don't think there's been a significant amount of research evaluating the effectiveness of wellness programs. But I would add that some people question with the 10-hour shifts that, you're now paying for 30 hours in a week instead of, or 30 hours of hours a day as opposed to 24 hours. But things can be accomplished in those additional 6 hours besides just overlap. Some departments have opted to do training and things of that nature. So a wellness program that took advantage of, times where officers don't have to be on the street wouldn't have to be that costly, because peers can develop some of these programs, and people that are already housed in police departments can do a lot of that work, putting together lists and contacts and things of that nature. So I don't believe that they have to be as expensive as some people claim them to be.
Okay. Anyone else? Let me ask, and Brian, I think you've done some work in this area. Is there any research out there looking at how officers going through stressful situations can be debriefed in a way that the stress and fatigue is somewhat abated? Are you aware of any of that research out there? John, you may be able to comment on this as well.
Yeah, I do know that it's out there. Greg Belenke's work with the Army during the first Gulf War, for example, started a number of things. But John's the expert on this. So, John, I defer to you.
Well, certainly there are methods. I think some departments now are using biofeedback to help officers come down, if you will. I think sometimes when you have a lot of stress and your cortisol rises up to a level, it never comes back down. And if that dysregulation happens in your body, it's going to cause you to be hypervigilant all the time. But biofeedback can help deal with that. I know one of my colleagues in NIOSH, Mike Andrew, is dealing with heart rate variability, on how to slow your heart rate down by biofeedback and actually calm you down using that sort of method. I think counseling is good. I think Andy O'Hara from the Badge of Life website has an idea that every officer should have a mental health check every year, just like an officer would go to a dentist every year or every 6 months. And even if they don't have problems, just to talk to somebody. And sometimes that support is very important. I think another thing that's important is organizational support. We talk about resiliency, and we talk about how resilient people don't get stressed out. Well, resiliency is a personal trait for many people, but it's also a social trait. Police organizations who support their people are more resilient. Police organizations that care about their people are more resilient, and their people are more resilient. And they can face these things, and they can make it through these things without getting stressed out or without getting PTSD. But the programs, I know there are a few programs that are really good out there, and I think Sheriff Baca out in L.A. County has a very good program, as well as down in Dade County in Florida. But they take care of the people. I think that's an important thing.
Okay, now staying with you for a minute, John, I know that this next question comes in and it really cuts to some of the work you've done, actually some of the work you mentioned at the COPS conference in Washington, D.C. last month. And the question is, how significant are factors like gender, or race and ethnicity when it comes to officers and how they cope with job-related health issues? And I know that gender in some of your work has come to the forefront.
Mm-hmm. Yes, actually, it has. Women officers seem to have higher health disparities than our male officers in our studies, especially in the area of cardiovascular disease. One of the things we do is check artery health, and women officers don't fare out very well in that. As well, women officers have higher levels of the metabolic syndrome. They have higher levels of PTSD. And one of the factors behind that is administrative support. Again, the women officers don't feel that they're well supported by the department as much as male officers are. And this comes to play in the psychological difficulties that they start to experience. As well, they have different responsibilities than male officers. They have families to take care of in some respects. They have other things to do away from work. Sometimes we have couples where a woman is an officer and a husband's an officer, and they're working different shifts. And in that situation, it really disrupts the family. External demands really seem to take their toll on women much more than the men officers, from what our research shows. The negative experiences that occur outside of work seem to affect them a lot. So, yes, in summary, I think women officers are really, from what we've seen in our research, really have more difficulties with the job than the men do.
Okay. And then let me just throw this out to you, Brian. I don't know if you've done work in this area. I know that when we funded a number of our CLEFS projects before you came to NIJ, there were a number of programs that looked at the role of clergy and partnering with departments in suicide prevention. And maybe, John, you're aware of some of these programs as well. But are you aware of any of those programs that are geared towards making officers safer by incorporating clergy into their wellness programs?
I don't know of any programs like that focus that way, with Chapman's Corps, for example. John, do you?
I think there are a lot of departments out there that have chaplains, probably more of the bigger departments. And there have been chaplain training centers not centers, but chaplain training seminars to help train chaplains about police officers. A lot of them are not police officers, and they don't understand the psyche of a police officer. And I think they're told about this, and they're given training in suicide awareness, and they're given training on what officers go through. They might be put through a Citizens Police Academy to learn more about what officers need to go through every day. And there are things out there like that. I think chaplains are important. They're very important in the military, and they're also important in police work. There's someone you can go to and talk to without getting noticed, without having to divulge that maybe you're not feeling quite good about life and so forth. But I think they're really a good resource.
Another thing I might add is that a number of agencies have employee assistance programs, and I have experienced just anecdotally from being in a lot of police agencies that they tend to have greater success with officers actually partaking in the services of the EAP if they're housed outside of the police department. Those that manage or house their own programs don't seem to get the same level of attendance. So there is some issue about the separation of services offered by a police department, particularly ones of a confidential nature.
Excuse me, that's an interesting point, Karen, because when we funded a number of our earlier CLEFS programs, one thing we found is that even having these facilities off-site and outside of the view of the departments did not lead to more participation from officers. They did not trust the service care providers. I think part of that, obviously, they knew that there were only a number of things they could say beyond what could get reported to the chief or to command, but even moving those things off-site did not kind of put officers at ease. They didn't tend to trust the doctors.
Mm-hmm. Right, and another sort of anecdote to kind of add on to that is that many times, I mean, cops are just by their nature, because of the work that they do, very suspicious. So it may not be that they don't trust the doctors, it's that they don't trust the department to not be able to get information from doctors, even when doctors tell you it's confidential. So they think that there's some way that their agencies can find out about it and it can put them in jeopardy. But that's usually for the more serious things. In my experiences, EAP programs that offer sort of routine kind of training and not in-depth counseling, that officers are more likely to take on those kind of things with an EAP that's off-site. But in terms of these more intense issues, and a few people have brought up in the chat room about critical incident stress debriefings and whatnot, that even that kind of a mandated thing, it's difficult for people to disclose in those kind of settings. But with peers offline, it's not quite as difficult. So, I mean, these are sort of psychological aspects of feelings of safety and confidentiality, and some police departments have used things against people in the past, so there's a reluctance to kind of trust that if they're paying for it, that they're going to somehow have access to the data.
Mm-hmm. So, Chief, how do you create this culture of trust in your department where officers can feel that they can seek help from either other officers or from some type of health care provider?
Yeah, a lot of the trust that officers experience develop over time and over a relationship. I think police executives and then agency leaders have to create the kinds of programs where officers are invited to go in and participate, and then they have to demonstrate confidentiality, as Karen indicated, in cases where it's absolutely critical to the employee's well-being, and after that's happened multiple times, and officers tend to develop the kind of confidence in the leadership and in the system that they can go and use those kinds of services. But it's critically important that the leadership of an agency, from the chief executive down, from the first day of the police academy or from the first day of training, if it's corrections or somebody else, that they talk about the kinds of emotional issues as well as the health issues that might very well occur, and that they open that door for services, and they let employees know from the beginning that it is an expectation of management that they fully utilize available services and that confidentiality requirements will be respected.
Thank you, Chief. John, I'll put this question to you. You talked about two good programs, one in L.A. County and one in Dade County. Do you have an idea of how those agencies support resiliency? What makes those programs, in your estimation, good ones that are out there?
Well, I guess I can start with one word, and that's trust. I think the chief brought that up. If you trust leadership, you're going to have a successful program. If you trust leadership not to betray you in terms of confidentiality, you're going to have a good program. They utilize they have some very good police psychologists out there, which the officers can see. They have peer support programs out there which the officers can use. And again, peer support works very well. You know, there's nothing better for a cop to talk to another cop. And there's a mistrust of mental health professionals because they'll feel that, it's going to be divulged in some way that they're crazy or they're going to lose a promotion or whatever. But I think trust is very important. That's what promotes resiliency. If you trust the leadership, and the leadership understands how to keep confidentiality as an important issue all the time.
Are you familiar with any of the working relationships that either of those departments have with the unions?
I am not, but I would assume that the unions would agree to peer support programs. I'm not sure what they do with the other things over there. No.
Yeah, I just ask because unions are a big key in a number of these relationships, and they can they oftentimes can dictate how successful these programs are if they're involved in the conversation.
Well, I agree to that. I agree, and I think sometimes it can be a hindrance. Unions look for the good of the officer, and that's what they're supposed to do. But let me give you an example. For example, if I were a police department and I mandated that you have a physical exam every year for your health's sake, and the union said, no, I don't want you to give a physical exam to my people because if you find something wrong, you're going to fire them. That sort of infighting that goes on leaves things at a stalemate. So I know officers who haven't had a physical for the last 15 years because they're afraid they're going to get fired or something. Unions and departments have to get together and make a pledge to each other that they're not going to chastise an officer for finding something wrong on a physical exam.
Yep.
Yeah. Brett?
Yes, sir.
This is Brian Vila again. Just want to reiterate one of the things that you've raised with talking about labor and management, and that's with the hours of service and fatigue management in general. Both parties have got a stake in the problem. If the officer's doing everything right and the department's screwing with shifts and schedules in a way that's unhealthy or unproductive, the officers are still going to be overly fatigued. If the department's doing everything right and the officer doesn't, same problem. So they've got to work together to do it, and they've got a common ground over these issues of health and safety on the labor side, and of risk management and human capital conservation on the management side. That common ground brings them together. I've worked with a number of departments arbitrating those sorts of things, and once they realize they've got to pull and harness together, you can get things done.
And I know Karen had to deal with that in Detroit and had a number of issues that went well. I mean, the two departments in her study were kind of an open door. I mean, I'm not going to paint it as an easy study to pull off, and there were other departments where I think she had to pull up stakes and move on. Is that right, Karen?
Yeah, absolutely. And I would add that I recently did work with a union, which isn't something that we would normally take aside, but there was a chief in the Midwest that was wanting to maintain rotating shifts. And because there was so much evidence out there that it's not healthy, the union started to collect that evidence, and I think they had originally asked John to present, and John was busy on the day that they needed it, so I came and did it. And I told the chief the main issue that I saw with this agency was that the chief wanted to know that he had the discretion and could maintain the authority to do what he wanted to do. And while that is certainly an issue between management and labor, sometimes it's not necessarily in the best interest of that chief or of the officers. So I didn't really see good arguments other than him wanting to maintain the ability, because as you hear, as you go around, as many of us have, and listen to issues between management and labor, it's often an issue of once we give something up, we're never getting it back. So it becomes a tit for tat. The union says, we want this, and management says, okay, we'll give you that, but you got to give us this. And so that becomes sort of a challenge in a lot of these kinds of issues. And there just has to be a lot of respect and a lot of, if we stick to the evidence, and a lot of chiefs and our new president here at the Police Foundation, as well as our former one, was really committed, as NIJ is and many other organizations, to evidence-based practices. If you stick with the science, then no matter what side of the equation you're on, you're going to do what's best. And that's, I think, where a lot of the problems have occurred, is that it's more about a political battle than it is about let's do the right thing. And Chief Bowman has to be commended because his focus has always been on let's do what's right. I don't know what it is, but let's collect the data to see what it is.
Mm-hmm. And because he was that kind of chief. Chief, I want to give you the last word as we wrap up.
Well, thank you again. Again, my compliments to everybody here. I believe that we, in policing in this business, we're so adept at basing our decisions on empirical evidence. It's critical that we look at this, that we listen to the voices out there, the doctors that we've heard today and the other academics that are on the call, because at the end of the day, we are steward over the resources provided to us by our investors. Those are taxpayers. And to the extent we can reduce health insurance costs, we can reduce the cost of actually providing people and services will benefit us all, and it increases the longevity of our personnel. So this is critical. Thanks, Brett, for your part in helping to moderate this as well. I think that we and all of policing and all of criminal justice will benefit from these kinds of discussions.
Well, thank you, and I thank you all for participating on today's session. I don't know if we can get our slide up, we have a website that we do maintain and keep up to date on these issues. You can access our website at www.nij.gov. We have any number of funded research final reports that can be found at ncjrs.gov. Anything that we fund, it belongs to the taxpayers, so it's up. Jessica, I'll turn it back to you, but before I do that, I would like to thank everyone for joining us today on this call. I cannot say thank you enough for our presenters, the researchers, and also the chief. Really appreciate you all being here today, taking time out on this very important issue of officer safety and wellness. And with that, Jessica, I'll turn it back to you.